Hello and welcome to Does My Child Need Therapy Services? How can I tell? If you are a parent or a caregiver or just anyone who loves a child that is doing something a little quirky or they're not doing something that you feel that they're supposed to be doing, this presentation is for you. I'm going to give you some information and some things that you need to consider regarding whether your child is developing the way that they're supposed to, and then what to do about it. I'm actually going to give you a phone number that you can call to speak to a licensed physical, occupational, or speech therapist so you can ask questions and get the answers that you need. So let's start the presentation. Who am I? My name is Jocelyn Washington. I'm a pediatric and neurological physical therapist. I've been practicing for over 20 years now, and I'm also the owner of a rehabilitation clinic. It's called Rafa Physical Therapy. And I love working with kids with special needs and their parents. So here's some information about Rafa Physical Therapy. We are located in Montclair, California. And this is the phone number I want you to call if anything I talk about rings true for you. Our phone number is 1-888-300-4102. That's our hotline that we set up so that you can ask questions and get answers that you need. We can make an appointment with you with a licensed physical, occupational, or speech therapy service. A physical, occupational, or speech therapist. So you can get the answers that you need. You can also reach out to us by email. It's at info@rafapt.com. And then also our website is www.rafapt.com. If you're able to, go ahead and grab a piece of paper and a pen and write down this information. Don't worry if you don't have one right now. I'm going to show the slide later on in the presentation a few times. And so you can get the information that you need, and we can work with you. So let's start the presentation. Here we go. Okay, the first way to know that your child needs therapy services is your request, the parent's request. And this may seem so simple, but really sometimes this is the hardest step, to even talk to your doctor and say like, hey, I noticed that my child isn't sitting up. What should I do about that? You know, and you may not even know that it's a therapy that your child needs. And a lot of times, you know, if you bring things up with your doctor may say, oh, well, it's okay. Don't worry about it. It's normal. Let's wait and see. I want to urge you not to just wait and see, because sometimes when you wait and see, sometimes things can get better, but a lot of times things can persist. And if your child does have a developmental delay or a neurological disorder or just anything that is causing your child not to develop the way that they're supposed to, you don't want it to get worse. So go ahead and ask the doctor for that referral. And then also, if you're not able to get the answers that you need from your doctor, please give us a call and we can guide you in the right direction. We're here to help you. Okay, so your child at 3 months. Let's talk about your child at 3 months. So if they don't respond to loud sounds, that's usually the first indicator that something is going on. If you clap real loud, or if you shout real loud, or if there's loud music, they should be responding to that. If they're not noticing their hands by 2 months, you know, they should be waving their hands in front of their face like, oh, what's that? That's an issue. If they're not smiling at the sound of your voice, or with the last bullet point, if they're not smiling at other people by 3 months, 2-3 months, you definitely want to talk to the doctor about that. You know, like, why isn't my child responding to their environment and the people in it? If they're not following moving objects with their eyes, and then also if they're not grasping and holding objects by 3 months, that's also something to look at. Now, grasping is different than grasping and holding. So they should be able to hold a rattle in their hand and move that thing around and notice what's in front of their face. If they're not doing that, please talk to the doctor. At 6 months, our baby should be moving around and trying to get into things. But if your baby is very stiff with tight muscles. They can't move. They can't seem to move their arms and their legs, and it's just really, really tight. You're trying to move it, and they just kind of recoil back up. Please talk to the doctor. And then on the other hand, if they're very floppy, like a rag doll, it's like you're picking them up and they're not holding on to you. They're not trying to hold up their head. If you lift up their arm and it just flops back down, that's definitely something you want to talk to the doctor about by 6 months. And in line with the floppiness, if you're pulling them up to a sitting position and their head is still flopping backwards, then you definitely want to talk to the doctor, because that's an indication of very low muscle tone in the neck muscles. If they're only reaching with one hand, and again, if they're not responding to the sounds around him, that's definitely something you want to talk about to the doctor. And then if they're refusing to cuddle, if they don't want to lay their head in the crook of your neck and or on your shoulder, and they don't want to just climb up in your lap when they're tired, definitely talk to the doctor about that. And this goes in line with the affection. Like, if they're not showing any sort of affection for anybody who cares for them, that's a serious issue. If they don't seem to enjoy being around people, they don't really like people. By 6 months, they're interacting, and you're holding little baby conversations with the baby, with the child. So if they're not doing those things, please talk to the doctor. If one or both eyes are consistently turning in or out, that's something you want to talk to the doctor about. And then also in their eyes, if there's persistent eye drainage or they're just super sensitive to light, please talk to the doctor about that. Some other things, if they have difficulty getting objects to their mouth, that's also serious, because at this age, they should be, putting the rattle in their mouth, their feet in their mouth, their hands in their mouth. Everything should be going in their mouth by this age. So if they're not doing that, this is an indication that something is going on. Again, with the loud sounds, if they're not actually turning their head to locate sounds by 4 months, you definitely want to talk to the doctor about that, because we want your child to be able to turn their head and say, oh, that's mommy talking, or oh, that's daddy talking, or oh, that's a song that I like. Another big one is if they don't roll over in either direction, to front to back or back to front by 5 months, you want them to be able to do an entire roll from their stomach to their back, or vice versa by this age. And I know that babies don't sleep a whole lot. Their schedules are a little bit off. But if your baby is just really inconsolable at night, I'm talking like they're screaming and they're yelling and they just will not go to sleep, that's definitely something you want to talk to the doctor about. If they're not laughing or squealing, if they're not actively reaching for objects, and again, if they're not smiling spontaneously, you want them to be smiling and laughing and squealing and interacting with their environment. And then the last thing is, if they can't sit with help by 6 months, this is definitely something you want to talk to the doctor about. And by with help, I mean they should be able to sit in your lap or sit up against the back of the couch or something, not necessarily sitting on their own, but sitting with help. They should be able to hold their trunk and their head up at the same time. A little side note with this slide here, a lot of parents ask, well, shouldn't my child be crawling by 6 months? Well, at 6 months, many children do crawl by 6 months, but it's really by 9 months or 10 months. If they're not crawling by then, that's when you need to be concerned. But by 6 months, it's okay that they're not crawling by 6 months. Again, we are Rafa Physical Therapy. This is a picture of one of our therapists and some of our patients. We're located in Montclair. If anything that I've said to you thus far rings true, and you just need to speak to somebody about what you're seeing in your child, please give us a call. The number is 888-300-4102. And our email is info@rafapt.com. And our website is www.rafapt.com. We want to help you. We want to validate your concerns. And we want to help you to get the best care for your child that you possibly can. And we want to be there in your journey to to get the care that you need to get for your child. So give us a call. Let's talk about your baby at 8 months. So at 8 months, they should be following objects with both eyes at 1 foot and at 6 feet. So you want them to be able to locate you across the room while you're walking to the kitchen, and then also when you're really, really close. You want them to be able to bear some weight on their legs. Now, they don't need to be standing up completely by 7 months, but they do need to be able to bear some weight. So let's just say you have your child, you're holding them under their armpits and you put their feet on the ground. They should be pushing against the ground upward. So if they're not doing that, please talk to the doctor. They should be trying to attract attention. So they should be throwing things. They should be, like rattling things. They should be trying to pull on your hair if they want your attention. At this point, your children, you want them to be a little bit annoying, and that's totally normal and it's natural. If they're not babbling by 8 months, that's something to look at. And also, if they're not showing interest in games of peekaboo, that's also something that you want to really be concerned about, because peekaboo, it's a game that's kind of universal, and some kids will laugh, some kids will get scared, some kids will cry, but you really want them to be interested and show a reaction with the game of peekaboo. So if you haven't played peekaboo with your child, play peekaboo and see how they react. Up to 12 months, again, if they're not crawling by 12 months, this is something you really, really want to talk to the doctor about, because your child should be crawling. And on the other hand, let's just say they are crawling, but they're dragging one side of their body. This is normal for the very first month, but only for the first month, for the first month and a half. If by a month and a half, they're still dragging one side of their body, then that's something that you really want to take a look at. And then also, if they can't stand when supported, that's something you really want to talk to the doctor about, because you want your child to stand. And by supported standing, I'm talking about, they need to be standing in front of a couch, in front of a coffee table. They need to be standing in front of some place. And then also, if they're not searching for objects that are hidden while, he watches, if you have a ball and you cover it with a blanket, if they're not, where is the ball? That's something you also want to look at. If they're not saying any single words, no mama, no dada, no mine, no, they need to be saying something by 12 months. Now with boys, this is a little bit different, because boys tend to speak later than girls, but they should at least be babbling, and you should know what they mean when they want something. So that ties into that last bullet. If they're not learning to use gestures, just such as waving or shaking their head no, or, clapping their hands when they're happy, they should be able to gesture to communicate with you. If they're not pointing to objects, or if they're not seeking attention, again, with those gestures, it's something to look at. And then also, at this age, your baby should be bringing you toys to share with you. Like, hey, mom, what is this sock? Or what is this hairbrush? Or what is this toy? Or how do I get this toy to turn on? If they're not acting out a familiar activity, like pretending to take a bath, or brushing their hair, or brushing their teeth, that's something to also look at. But then also, with play at this age, they should be able to play alone, and they should be able to play with other kids, and they should kind of compete, like, this is my toy, and this is not my toy, this is my toy. You want them to compete with other kids their age. And another thing is, you want them to be able to recognize themselves in a mirror or in pictures. So you can say, oh, this is mama, or this is dada, or this is Katie. You want them to be able to identify themselves in a mirror and in pictures. A lot of parents ask me at this age, by 12 months, is my child supposed to be walking by 12 months? Well, actually, normal walking is actually up to 18 months. So if your child isn't walking by 12 months, 1 year old, that's totally okay. But by 18 months, they should be walking. And if they're not walking by 18 months, again, that's something that you want to talk to your doctor about to get a referral. So that is the end of our presentation. Again, we are Rafa Physical Therapy. We're located in Montclair, California. Please call us if there's anything that I spoke about today that rings true for you. Our phone number is 1-800-300-4102. Again, 1-800-300-4102. And our email is info@rafapt.com. Please make that phone call, even if it's right now. We have people who are going to answer the phone and they're going to take your information, and we're going to set an appointment for you to speak to a physical, occupational, or speech therapist to get the answers that you need. And even if none of this ring true for you, but you still have questions, please still even call us. We want to make sure that your child is their best ever. So let us help you help your child. Okay, and thank you, and we'll talk to you soon.